welcome today for our proclamation for the kickoff to Men's Health and Prostate Cancer Awareness Month. I'm Scott Davis. I'm the CEO at Arkansas Urology. And this is our 16th year of providing free prostate screenings through Arkansas Urology. Over those years, we've been very fortunate and very proud to be able to offer those free screenings and services to men all around the state of Arkansas. The physicians and staff of Arkansas Urology this is a great event because they take a lot of pride in it. We have a lot of employees that volunteer their time and all for a good cause to catch prostate cancer early. We know in the urology field that if we catch prostate cancer early, it's extremely treatable, about a 99% cure rate. If we find prostate cancer in their later stages, it's often things that we can't do and quite frankly, very fatal. So again, we're very honored to be able to do this for our 16th year in a row. And without further ado, let me introduce one of our guest speakers today. Greg Feltus is a 14-year prostate cancer survivor, works here at Stevens and is a great patient and a great advocate for prostate cancer awareness. So with that, let me introduce Greg Feltus.
Scott, thank you very much. I'm delighted to be here in support of Arkansas Urology and the great staff and employees out there, doctors and terrific nurses. I had the awakening of a diagnosis of prostate cancer. My doctors we had been tracking and doing screenings, thank God, because it was early on and we were able to get ahead of it, ahead of the power curve, I call it, and we've stayed that way for 14 years, thanks to the great doctors and nurses at Arkansas Urology. It is a stunning, when you get that discussion, have that discussion with your doctor and they say you have cancer, it is stunning. So my recommendation to all the men in Arkansas and the United States and the world to get screened, stay ahead of it, know what's going on, check your PSAs, and get a great doctor and build a relationship with that clinic and have them track you as you go forward in life. I was diagnosed at age 55, which is pretty early on the age span, and that was, and it just came out of the blue. So I think the screening is critical. I'd like to say that the staff, Dr. Mooney and his team, Dr. Wong, and the nuclear medicine group at urology group they're just great people. Iris Kennedy, the APRN, and Jamie Nally, Christy Yates, all just a terrific group. Over this period of time, they're like family to me, and I really do appreciate it. You get treated with great respect, concern, and compassion from that team, and it's really wonderful to have that kind of resource backing you and your family. And so early screening is the key to survivability and the future. And so I thank you for having me today, Scott. And I'd like to introduce Chris Shinup, who is the director of the Arkansas Urology Foundation and director of marketing. Thank you so much.
How's everybody? So growing up, in communications class, remember they always told you to imagine people in their underwear. I never thought I'd be seeing people in masks, but it does just kind of make you realize you need to take a deep breath, and this is an exciting opportunity to be here. Thank you, Mayor, for coming out and proclaiming today Prostate Cancer Awareness Month. Greg, you're the perfect illustration of why we're here, which is prostate cancer prevention, intervention, treatment. As a grandson of a prostate cancer survivor, my granddad always said it wasn't if, it was when he was told that he had prostate cancer. He was diagnosed about 22 years ago, and today I'm proud to report that he is a healthy 97-year-old prostate cancer survivor. So the Arkansas Urology Foundation mission is to raise funds and heighten awareness for prostate cancer across Arkansas. We're going to do that through Men's Health. We're going to do that through our urology programs. But it's such an honor to be leading these efforts, thanks to Scott Davis and our physicians at Arkansas Urology, the premier urology practice in Arkansas. Real quickly, if you're an employee at Arkansas Urology, will you raise your hand? So y'all are the heroes who help everybody every day, who work the front lines, who help the patients, who help Greg, who help the family members, who are just advocates for Arkansas Urology, and we wouldn't be here without you. Today, this afternoon at 5 o'clock, we'll be kicking off our Kickoff to Men's Health event, which is a free prostate cancer screening for men across the state. We have them in Little Rock, North Little Rock, and starting this month, we're expanding them to Pine Bluff, Northwest Arkansas, and El Dorado. So thanks to our presenting sponsor, CHI St. Vincent, for making that possible. I know we have some friends here from Mengen Holcomb who have made us all look good, kind of behind the scenes and getting everybody prepped for this press conference. But thank you for being here. And Mayor, thank you for proclaiming today Prostate Cancer Awareness Month. The mayor and I got to work together, I guess right out of college, which that was just a few years ago. I'm not gonna age ourselves, but it's fun to go back and kind of relive some of those memories of when we were growing up. But if you met Frank Scott back then, you knew that he was destined for greatness. You knew that he was on the path to become something important, something like the mayor. The mayor's hashtag, commonly, as my dad, who's over here, Jim Shinup, retweets, is Unite Little Rock. And today we're here to unite Little Rock around prostate cancer, regardless of your age, your race, your income, who your friends are, where you live, because it's important to get checked, it's important to get screened. There's no discrimination when it comes to prostate cancer. So thank you for being here. And at this time, Mayor, I'll let you make your proclamation and say a few words.
Well, thank you so much, Chris and Shinup, as I call him. We go way back, and I'll date ourselves. We're what we would call elder millennials, and so he and I graduated college around the same time, and I think we've been knowing each other now somewhere close to 15 years, so close to 2 decades. And Shinup is still the vibrant communicator that he is, and it's awesome to see his growth as we've grown together throughout our journey as we stand here today. But for today's point of discussion, is a point of discussion that truly, as Shinup shared, it's about uniting our city. And so one of the things that we understand in the midst of this global pandemic, and if anyone's been paying attention, as we all are, even though it's kind of interesting to say that we're getting in the routine of a crisis, this truly is a crisis in COVID-19, and that in a couple of weeks, we would have been in this crisis 6 months. It's unbelievable that we started here on March the 12th, 2020, and today is September the 1st, and close to 10 more days, it'll represent 6 months that we've been in this global pandemic. But one of the things that we've understood in the midst of a global pandemic, life does not stop. Healthcare disparities do not stop. What we understand right now more than ever is that healthcare disparities as well as financial disparities are now being demonstrated in a higher awareness. A doctor would say an acute awareness. That we now see that these healthcare disparities are now pushing towards the drastic effects of COVID-19 even faster, which is all the more reason why we have to be focused on prevention, intervention, and treatment right now. No longer can we wait to go get a checkup. No longer can we wait to say that I'm too scared to go. As a grandson, as a nephew, as a cousin of men that have been diagnosed with prostate cancer, we understand that we have to go get our checks now. Quite frankly, if you understand the numbers, prostate cancer represents 30% of all cancers in the United States. 30%. But even more, if you look at the effects of this particular cancer and the understanding that we have to always go to hard to reach areas, and that's the reason why we talk about uniting our city, because we understand that 1 in 9 black men don't know that they have prostate cancer because A, we struggle with going to see the doctor, B, we don't want to see the doctor, and C, we don't want to hear what the doctor has to say. And hence the reason many times when we finally do receive a checkup, it's too late. And so that's the reason why we have this type of awareness. Because it's not only has a disproportionate effect on black men, it has a disproportionate effect on all men. And that's the reason why you have an example in a Greg Feltus who's had his first check at 55, when most people will say it's not a matter if, it's a matter of when, but you don't want to wait to the end. And so that's why we have to start early and go often to ensure that we're taking care of our best selves so we can be our best selves for our community as we are uniting our community together. But it's a team. And that's the reason why Chris and Scott are working together with Arkansas Urology to ensure that we make everyone aware, that we provide opportunities that all men, no matter if you're black, you're brown, you're white, irrespective of your religion, irrespective of anything, that we have to receive the prevention and the intervention and the treatment so we can save ourselves, so we can preserve our city, so we all work together. With all that being said, on behalf of the City of Little Rock and City Board of Directors, we proclaim today Prostate Cancer Awareness Day. Thank you.
Thank you, Mr. Mayor. And no better words are spoken. You know, as Chris alluded to and as the mayor did too, prostate cancer doesn't care what color your skin is. It doesn't care how much money you make. It's important that we address this preventive issue that we have a lot of control over. Men notoriously are afraid to go to the doctor. They're afraid to get the health care. And part of our mission of raising funds in our foundation is to offer not only the free screenings that we're going to offer this month with our Kickoff to Men's Health, but also at our Arkansas Urology Men's Health Clinic, where we offer free screens every day. So having said that, this year, as Chris said, we've got 5 events. There are definitely health disparities in the state. We want to address that. This is the first year that we've gone down to Pine Bluff and to El Dorado. And so these are areas that definitely have some disparities in health as well as income, and we're very focused on providing those free screenings in those markets as well. This year will be a little different because of COVID. For the gentlemen that are coming in, we're going to ask them to check in under our portico, stay in their cars. We'll bring them in. We'll practice social distancing. We'll provide all the adequate safeguards and safety that we can to make sure these men get tested. And as Mayor Scott alluded to, this isn't a time to not get health care. This is absolutely the time to get health care. Do not let the fear of COVID erase the ability for these men and women to go get screened and tested for all types of issues. So with that, I'd like to close with just a simple statement about the purpose of Arkansas Urology. And it's real. I had this conversation with my team this morning. Working as one, we will improve someone's life today. Thank you all for coming, and thank you, Mr. Mayor, for the proclamation. And
I want to make sure that I actually give you the proclamation.
Okay, great. Well, let me get the mask on if we're going to.
Can we pause for a photo?
Oh, sure.
Oh, absolutely. I'm sure everyone out there is tired of photos, but
Well, I'm sorry.
thank you very much. And thank you all for attending. Be safe, and looking forward to a wonderful event. Greg, thank you for coming again. Appreciate your support. Chris, outstanding job as always. Thanks again, guys.